With more than 230,000 new cases every single year, chances are you know someone who is or has battled breast cancer.
The words "you have breast cancer" are enough to send anyone into an emotional spiral. As many as 1 in 4 patients needs more surgery following a lumpectomy.
Getting breast cancer diagnosis was hard enough, but if you have to go back in a second time for surgery, it really impacts you.
We have to get the whole cancer out, and we have to get a clear margin or a clear area of normal breast tissue around the cancer.
In the last 25 years, there's been no advance in trying to get us a needed analysis of margins.
Over the years, we've tried innumerable things. We put in multiple wires, we localize the cancer with ultrasound before surgery, we get MRIs.
If the cancer is that small, how do you know where to go to take it out? You can't feel it.
Margins are typically checked in pathology, so we don't know the margin until we get the pathology report back several days after surgery.
The surgeon cannot tell if there are microscopic amounts of cancer cells on the surface or near the surface of the breast tissue that's removed.
We have an important development in breast cancer surgery tonight.
Of new cancer technology. It can detect cancerous breast tissue not visible to the eye.
A new weapon in the fight against breast cancer is empowering surgeons and patients alike.
New hope for breast cancer patients, how doctors are able to better target hidden tumors.
Surgeon is finding success with a new device designed to cut down on a patient's chances of having to have a second surgery.
New technology is now preventing that second round of heartache for many patients right here in Richmond.
New technology to bring peace of mind to breast cancer patients.
This is an instrument called the MarginProbe, and this is actually what we use in surgery to look at that margin.
It may help to reverse a disturbing trend toward mastectomies in this country. Doc.
Recently, mastectomy rates have been going up. There's a device that might slow that trend.
For the last year, Castile has been using a groundbreaking new weapon in the fight against cancer.
MarginProbe does is it gives us more immediate feedback during that same operation to tell us whether or not there's cancer at the edge.
And it lowers the re-excision rates, and we can go from around 25% down into the single-digit percentile.
Already have several patients who have been able to avoid a second surgery because of the MarginProbe. It's a game changer, and it's huge.
It's really a win-win situation for everyone.
He's been using it for a few months now and says out of 50 cases, only 1 patient has needed a second surgery.
I can't imagine going through having drains and all of this and then have to do it again.
Fewer surgeries I can go through, the better for me, for my stress level and my, that's just important to me.
That would benefit me as well with the amount of surgery that would need to be done.
This wasn't going to be my journey. This was just going to be my bump in the road.
I didn't look back. That was probably the best decision. And now you can ask me how blessed I feel.
Cancer-free. So I'm happy and I'm very pleased with my results. Had that not happened, I would have had to have a second surgery, which would have been delaying my recovery, delaying radiation, so the process would have just been extended.
It's a huge game changer. If we can reduce re-excision rates, I mean, everybody wins.